Welcome to NYC Now, your source for local news in and around New York City from WNYC. It's Monday, August 18th. Here's the morning headlines from Michael Hill.
Officials say they're concerned about the potential for a retaliation after a targeted mass shooting at a Brooklyn hookah bar early yesterday. It killed 3 people and wounded 10 others. Mayor Adams says crisis management teams are already on the ground in Crown Heights.
We're always concerned after a shooting. The retaliatory shootings will follow if we don't get on the ground with our crisis management team and other partners.
The NYPD says the shooting at Taste of the City Lounge appears to have been gang-related, and they believe there were as many as 4 shooters. No arrests reported just yet. Mayor Adams is down a board member at the MTA. This comes as the public will weigh in on new fare and toll hikes at hearings this week. WNYC Stephen Nesson has more.
The mayor of New York has up to 4 representatives on the MTA board, but he's only got 3 at the moment. That's because one of his former deputy mayors, Meera Joshi, resigned from the board in late June. Adams never lined up her replacement, and he won't have a chance to get one confirmed until state lawmakers return to Albany. The next session isn't scheduled until next year. Joshi had remained on the MTA board for several months after resigning as deputy mayor amid Adams's corruption scandal. The MTA board is expected to sign off on a $3 subway and bus fare set to take effect early next year. The mayor has called the hike, quote, offensive to New Yorkers.
We're in the mid-60s now with clouds, mostly cloudy today and 76 for a high. Winds up to 15 miles an hour. Then tomorrow, mostly sunny and still in the 70s.
Stay close. There's more after the break.
NYC.
It's All Things Considered on WNYC. I'm Sean Carlson. According to health experts, there is a disproportionately high rate of undiagnosed and life-threatening heart conditions among black men in New York City. Mount Sinai Hospital, along with a nonprofit group called Real Dads Network, are hosting free heart screenings specifically for black men to detect serious heart conditions. Joining us now are Mount Sinai doctor Isilma Fergus and Kenyatta Rouse, who's part of the Real Dads Network and a former NYPD detective. Both helped initiate free heart screenings for black men here in the city. So, doctor, why are black men more likely than other groups to have undiagnosed heart conditions? Is it an issue of access to care or problems overlooked?
Yeah, good afternoon, everyone. I'm happy to be here to answer such an important question. So it's multifactorial. It's not a simple answer, but part of it would be what you call the social determinants of health, social and or structural determinants of health, such as what you mentioned, access, etc. But I think that a large portion also has to do with understanding the culture of Black men. Sometimes there's pride involved, or, just feeling that they may not be manly enough going into the doctor all the time. So the type of thing that we're doing, going out into the community and reaching out to people where they can talk and they can feel that they can trust the individuals, is really helpful. And we hope will help to eliminate some of these disparities.
Kenyatta, can you briefly tell us about how changes in your own health led to increased awareness about the need for regular screenings?
Absolutely. Good evening, everyone, and thank you for having me here today. Actually, we always say, and I'm going to take a quote from my brother Puma from the Real Dads Network, I will die for my kids, and I would die for my family. I'll do anything for my family. So what we're trying to do at the Real Dads Network is change that narrative and say, let's live for your kids and let's live for your family, because we want to be around and we want to be healthy to see our family nourish and grow and for ourselves.
Now, doctor, you mentioned social determinants, right? Lifestyle factors,
Yes.
Things like housing, neighborhood safety, food deserts. How do those things affect cardiovascular risk?
Absolutely. So food deserts, for one, in Harlem, there are many great places, but in the surrounding boroughs, for instance, where many of the Black men live, there may not be healthy, accessible, fresh foods. And so just to eat, people may be eating more processed foods. Processed foods may be higher in sodium, which of course will make the blood pressure higher in sugar, which of course can give someone diabetes or make their blood sugar elevated. And of course, if things are processed and fried, etc., then you have elevated cholesterol that can be a result of all of that. So right there, you have three major risk factors, which are risk factors for the heart and heart disease. And heart disease is 80% preventable, but if people are not addressing these risk factors, they can lead to heart disease, including heart attacks, heart failure, and or cardiac arrhythmias, which are heart irregular beats.
Kenyatta, you work with a lot of Black fathers, right, while doing your work with the Real Dads Network.
Yes.
What message would you want to give to Black fathers who might be listening right now and are hesitant to engage with the healthcare system?
Well, to definitely go to your doctor, and also the Real Dads Network Fatherhood and Family Center, which is located in Spanish Harlem. I know the address is going to be given later. With the joint partnership that we have with Mount Sinai and our other partners, we're like, it's a welcoming, warm place. Is, I know a lot of people, men, don't want to go to a clinic or a hospital, or their personal private physician, but the Real Dads is a warm space, welcoming, no judgment. A lot of us men, we have egos, and you can just come in there. The staff of Mount Sinai is there. The doctors, the nurse practitioners are there to do the screening, and we'll get you in and out, give you a beverage, have something to eat after your testing is done, and we, it's a non-judgment space for men of color.
Doctor, knowing the disparities that do exist in this population, what steps can the medical community and doctors take to improve early detection in Black men beyond free heart screenings?
Yeah, and I think exactly what Kenyatta just spoke about. Having a space that people feel comfortable, they feel welcome, they feel warm, they're not judged, they don't have to worry about distrusting the healthcare provider and also access, because their location is right across from Mount Sinai Medical Center. Our clinics are there, our cardiovascular health clinics are there. So I think that, again, going out into the community, meeting people where they are, talking to them, listening to them, hearing about maybe some of the cultural contributors. You heard Kenyatta talk about ego or other things that could be preventing them from seeking help. Just being able to talk and help to mitigate some of these hangups can get people diagnosed. We get them screened, we get their blood pressures done, we talk to them, and then they could go right into Mount Sinai offices or clinics to be seen and taken care of. And I think that's a great help.
So let's talk about this free screening tomorrow. Like we said, it's at 1445 Madison Avenue. That's the address where folks can get that free screening. It's at the Real Dads Network and Fatherhood and Family Center on the Upper East Side from 4 to 7 in the afternoon. Kenyatta, you could listen to All Things Considered on WNYC while you're going. It is during this time slot.
Yes.
But in all seriousness, what should people expect to experience at that free screening tomorrow?
Well, you're going to experience, again, a warm, welcoming feeling, and with great people, obviously fathers and men, welcoming you to try to get you healthier and to assist you with whatever you need. I just wanted to, if it's okay, just to mention our other partners quickly: the Carver Houses Resident Association, the Black Nurses Association, obviously Real Dads Network. I also would like to, because I wear multi-hats, Medina Temple number 19, which is Prince Hall Shriners, which is a Harlem fraternity organization that we're out there in the community. And this is also with the Prince Hall Shriners, our national community health initiative. So that's why we partnered with Mount Sinai as well. And hopefully this is, because tomorrow's our second event, but hopefully this is the second of many to come in the near future.
Right on. Doctor, before we let you go, we wanted to ask you, if folks are feeling like something may be off, or they feel like maybe they do have a condition, what symptoms should they be looking out for when it comes to these kinds of heart conditions?
Yes, so typically you describe like an elephant sitting on your chest, maybe pain radiating down the left arm or into the jaw, shortness of breath, racing heart, feeling dizzy, any of those. But I would say, simply put, if you're just not feeling yourself and it's pervasive, it's ongoing, seek help. We're doing things tomorrow. We'll be screening blood pressures and we will be also swabbing for cardiac amyloidosis, which is a condition that can affect 4% of African American men with symptoms. But we will also be talking about high blood pressure in words that they can understand, men's health. And we have experts, as Kenyatta discussed, doctors from Sinai, nurse practitioners, nurses, student coordinators, researchers, all there to help to facilitate this for the men.
And I'm her patient, by the way.
So you can vouch for
That's
it.
my doctor.
All right.
Yes.
Well, that was Dr. Iselma Fergus and Kenyatta Rouse. Thank you so much to the both of you for joining us.
Thank you.
Pleasure being here. Thank you.
Thanks for listening. This is NYC Now from WNYC. Catch us every weekday, 3 times a day, for your top news headlines and occasional deep dives. And subscribe wherever you get your podcasts. More soon